Hi everyone, Dr. Nemechek here. I want to talk about something called MCI, or otherwise known as Minor Cognitive Impairment. All right. Now, back many moons ago when I was in medical school and training to be an internal medicine specialist, it was loosely referred to as pre-Alzheimer's. Like MCI and pre-Alzheimer's were the same thing. And to say pre-Alzheimer's is not a good sounding thing because that means you're supposed to go on to Alzheimer's. And all of that is completely false, okay? The majority of people with MCI never get Alzheimer's. So don't panic about that, okay? What is MCI, minor cognitive? It's basically forgetfulness, okay? And it's forgetfulness you're aware of. One of the hallmarks of dementia, like Alzheimer's, is they don't remember. They don't know they're forgetting. They don't know they've told you that story just 15 minutes ago or an hour, or it's been the fourth time today. They don't know that. They don't know why they went in the room and got lost, okay? That's dementia. Minor cognitive impairment is much more like, dang it, where did I put my keys again? Why am I always misplacing my keys? Or what is that guy's name? Gosh, he's been our neighbor for a few years now. Why can't I remember his name? The people, they're forgetful, but they know they're forgetful, okay? Alzheimer's, they don't know they're forgetful, okay? They don't know they're repeating things. Big difference right there. The other thing is, I've used for a couple decades now, looking at the autonomic nervous system to help manage brain recovery and so forth, that minor cognitive impairment's hallmark feature is they have poor blood pressure in the brain. Okay, now I talk about this with a lot of things because a lot of things have this. And now, let's use a different, so when you have low blood pressure in the brain, what happens is your red blood cells, so you breathe, you fill them up with oxygen. When you push them up to your head, the oxygen can't flow correctly into the brain, okay? The neurons only have 1 second of spare oxygen. And if that pressure's off a little bit, the brain's just not so sharp, okay? You know what else has low blood pressure in the brain? Attention deficit disorder. Attention deficit and hyperactivity disorder. Their autonomic hallmark is they have autonomic damage, they can't create the proper pressure in the brain, and they don't have enough oxygen flowing into the neurons, okay? And in those typically younger patients, what do? We give them Adderall and Ritalin and these kind of drugs. People talk about them like they're stimulants, like a big cup of coffee. They really stimulate the nervous system, and one of the major effects of stimulating the nervous system with those drugs is they push blood into your head. They increase the pressure in your brain, increase the flow of oxygen into your neurons, and hey, guess what? Your brain works better, okay? Minor cognitive impairment, their autonomic testing and features are exactly the same to me as kids with ADD. So just think of it as ADD in older folks, okay? Now, could you put them on Ritalin and Adderall? Possibly, but you got a higher risk of maybe some underlying cardiovascular disease you got to be careful of. You don't want to stress the heart too much or something like that. But theoretically, yeah, you could do that. Probably another one of the major things you can do is this low blood pressure will give you a false elevation of blood pressure. Reading in the arm, the body will squeeze down here to squirt blood to your head to try to normalize the pressure, okay? But you go to your doc's office to take a reading, you're 65, your pressure's up a little high, here's a blood pressure medicine, and that was really not a natural hypertension reading, it was a false one, a compensatory one. So what I do, if somebody has minor cognitive impairment, I check their blood pressure. I'll take their blood pressure and pulse twice a day for 3, 4, 5 days. Look at that, and you want to do it every day, days when you feel well, not just like in the afternoon if you have a headache, okay? That's going to give you some number that's meaningless. You want to check it every morning, and you'll get a sense of, hey, here's my real readings, okay? And you may be surprised. It might be like 105 over something, and you're on blood pressure medicines. Well, maybe you don't need all that. So I always advise you with the, in concert with your primary care provider, that You pick one of your blood pressure meds. So if you got, say, AFib and you need metoprolol for the heart rate, don't pick that one. Pick something like lisinopril or amlodipine, or in particular the water pill. Cut the dose in half. Wait a couple days, then check 4 or 5 more days. See where your pressure's at. And you'll be surprised. It won't change a lot, especially when you've got minor cognitive impairment, because that's low pressure in the head, not high pressure in the head. So you can serially go through, and maybe, if you're on 3 medicines, you might be able to get rid of 2 of them, and your blood pressure is still nice, 110, 120 in the morning. You don't have this extra blood pressure lowering drugs, which are making the brain worse, and so your natural pressure will normalize in the brain or become closer to normal, and you'll function better. That's super common. Okay? Now, if you have minor cognitive impairment and you aren't on blood pressure meds, the good news is your brain can still repair itself. Okay? The brain can still repair itself. And so what you do is, that's what our protocol is designed to do. With a high DHA fish oil, olive oil, balancing the gut bacteria, and at this age you're going to really need a vagus nerve stimulator. We lower inflammation and your brain can fix it. And typically 6-8 months, when patients come here and I'm kind of managing stuff, they're like, great. And if not a lot better, it's gone. Okay, and often the blood pressure meds are gone and stuff like that too. So it'll help a whole host of that thing. So hope that's helpful for you all. Otherwise, I'll have a good weekend. Take care now. Bye.